Hello, my name is Lydia Anderson, and today I will be presenting a proposal for innovative mental health for youth in foster care. This proposal is to fulfill the requirements of Counseling 606, Foundations and Contextual Dimensions of Clinical Mental Health. My professor is Dr. Angela Jackson. During the course of this presentation, I will be sharing with you an introduction as to the topic, an assessment regarding the need, the goals of this proposal, the delivery systems that will be utilized, the supporting resources, and program evaluation. Finally, we will conclude and references. Advocacy is at the heart of clinical mental health. Furthermore, pure and undefiled religion is described in the Bible as being taking up the cause of the widow and the orphan. Today, this proposal seeks to increase access for youth in foster care, arguably modern-day orphans, to help them to deal and work through past and present trauma while also preparing them to transition successfully into adulthood. The focus of this mental health proposal is on youth aged 14 to 18 years old who are residing in foster care in Baker County, Oregon. Empowering youth in foster care to advocate for their mental health through an alternate engagement model is the project presentation today. Why is this important? Youth in foster care have endured significant trauma as a result of the circumstances of why they came into foster care. According to COUN 2021, neglect is the most common reason youth enter the foster care system. Why is neglect significant? Well, neglect contributes to unhealthy attachment styles. If the primary caregiver isn't there, that's going to create some complex trauma for these youth. Additionally, foster care, the fact of being in foster care, was found by COUN 2021 to have trauma related to that in and of itself. Colondo and Levine 2007 found that 30 to 85% of youth in foster care have some kind of mental health disorder. Additionally, with all the trauma that these kids in foster care have experienced, youth 14 to 18 years old who have experienced high conflict in their family systems are vulnerable to delays in critical areas of development, according to Erford 2017. What are these areas of critical development? During this time, development of hypothetical deductive reasoning, abstract and multidimensional thinking is key. However, the circumstances surrounding high conflict family situations, not being able to depend on primary caregivers, and other circumstances of neglect make these youth at a high risk for delay in this critical area of development. They are preparing to enter into adulthood, and their handling and working through past trauma is key. However, the current model of engagement of youth in foster care engaging in mental health is not effective, according to Lakeshee et al. 2023. What is this method of youth accessing mental health care? The DHS, Department of Human Services, Procedure Manual states that all children coming into foster care must be referred for a mental health assessment within 60 days of coming into care. Youth that receive a diagnostic and statistical manual defined diagnosis will continue to receive treatment. However, If a youth and the trauma that they bring does not fit into one of these diagnoses, they will not continue to receive mental health care unless they specifically request it. Researcher Blake Shee and his colleagues found that youth in care didn't feel like their needs were being met by the current situation. They didn't feel heard, they didn't feel understood, and they felt very powerless in this system of mental health care for youth in foster care. So, what are the goals of this mental health proposal? The main and most important thing is that youth aged 14 to 18 years old residing in foster care feel empowered to advocate for what they need in mental health care. We want these youth to see going to counseling as a sign of strength and not a sign of weakness. Furthermore, changes in these youth's attitude towards mental health include a problem-solving mindset and knowing that you can never know it all and that it's okay to go and ask for help. Additionally, another important goal is including stakeholders in the mental health care process to increase support surrounding these youth. The delivery system starts out with speaking the language of the intended audience. Blake Shee, ET/AL 2023. This is important. Furthermore, reaching out to Department of Human Services, Child Welfare Program Managers, Supervisors, Caseworkers, Court-appointed special advocates, foster parents, and independent living program consultants. These are the people who have contact in the everyday lives of the intended audience, youth in foster care aged 14 to 18 years old. The structure of this mental health proposal consists of mental health groups led by trained near-peer group facilitators. So what is a near-peer? A near-peer is someone who has prior experience in foster care. They have lived what it's like. And now they have graduated with their high school diploma or GED and have received specialized training from another key player, the licensed clinical mental health professional who has experience and skills in supervision. These groups will be facilitated primarily by the near-peer mentors. However, the licensed clinical mental health professional will be on site and present during the group to provide intervention in scenarios that require more than what the near-peer mentors can offer. The structure of this group is composed of meeting twice a month for 90 minutes for 3 months for a total of 6 sessions. Blake Shee, ET/AL 2023. The near-peer mentors are key to these groups. Youth consistently say that they want to hear from someone who's been through what they've been through. As mentioned in the previous section, supporting resources include a clinical mental health professional who is passionate about youth and who has experience in supervision. Also, at the heart of the program is the recruitment and training of near-peer group facilitators, Blake Shee, ET/AL 2023. Additionally, foster parents have a huge impact on the everyday lives of the children residing in their home. These foster parents are invited to come consult with not only the near-peer group facilitators, but also the clinical mental health professional. Finally, child welfare staff are included in the supporting resources as they are the heart of foster care. They are working the cases that provide the support for these youth to engage in services. So all this fancy talk, but how will we know if this program is actually effective? Well, when a youth enters into the program, they will take a survey evaluating their knowledge and skills regarding clinical mental health. At the completion of the 3-month program, they will again take the same survey and the results will be compared. Furthermore, and very practically, success in this program looks like youth in foster care working through past trauma, present trauma, and gaining skills and tools to advocate for their mental health. Blake Shee, ETAL 2023. In conclusion today, I bring us back to the very start of this presentation, where I stated that advocacy is at the heart of clinical mental health counseling. Furthermore, youth in foster care, aged 14 to 18 years old, are in a critical phase of development as they prepare to enter into adulthood. The time to advocate for these youth is now, and the current system is not effectively engaging youth. This innovative mental health proposal for youth in foster care is extremely important, and I'm very passionate about it.